Hello there, this is Dr. Mintz. This is an elderly female who had a sudden onset of severe headache, lost consciousness. So what do you see here? There is high attenuation material in the suprasellar cistern and extending into the anterior cerebral artery and middle cerebral artery cisterns, as well as in the prepontine cistern. It has a stellate configuration typical of subarachnoid hemorrhages that occur from one of the main cerebral arteries in the region of the circle of Willis, and this is a subarachnoid hemorrhage. It's not uncommon for some of the hemorrhage to extend into adjacent areas of the ventricular system. And here, for example, you have some in the temporal horn of the left lateral ventricle that probably sneaked in there, snuck or sneaked from the basal cistern area here in through the sulcus along the medial aspect of the temporal lobe. Here you have old infarcts. See, there's no mass effect and they are fairly dark, just about as dark and low attenuation as CSF, so that tells you that they are old. Here's a small chronic old cerebellar infarct. And there's actually a little tiny bit of blood layering here in the dependent aspect of the right lateral ventricle. See that right there? And that's a little bit more than you see elsewhere. Not uncommon. The ventricles are moderately dilated and the cortical sulci are prominent, consistent with atrophy. So this is typical of a subarachnoid hemorrhage. Now this stellate configuration represents the circle of Willis and the orientation of its vessels. So you have a middle cerebral artery going out this way, anterior cerebral arteries going out this way, and you have communicating arteries that connect the middle cerebral and anterior cerebral arteries. And similarly, you have posterior cerebral arteries, not as well portrayed in terms of the anatomical location of the blood, but the subarachnoid hemorrhage often tracks along these blood vessels because it is the blood vessels of the circle of Willis which give rise to the aneurysms that bleed, and therefore the bleeding tends to track along the potential space between the vessels and the adjacent brain, and those are these cisterns that go in the anterior interhemispheric fissure here as they follow the anterior cerebral arteries, and toward the sylvian fissure laterally here, and the middle cerebral artery cistern, which is where the middle cerebral artery itself courses as it approaches the convexity of the brain, at which point it starts branching over the convexity of the brain. So we also have some blood in the prepontine cistern, and here is the pons. Here is the midbrain with the cerebral peduncles on each side, and there's blood in the interpeduncular cistern. That's the cistern between the peduncles, and a little bit of blood in the cisterns adjacent to that. Cistern is just a potential space or a small space that communicates with the basal cisterns, some of which are named. Here you have the midbrain close to the superior aspect of the cerebellum, and here you have some small chronic cerebellar infarcts. So this is a classic subarachnoid hemorrhage that is filling the suprasellar cistern, and that's because most cerebral aneurysms occur at bifurcation points of cerebral arteries, particularly those of the circle of Willis. So this is a configuration that actually represents somewhat the stellate configuration of the circle of Willis, meaning middle cerebral arteries go out this way, anterior cerebral arteries go this way, and posterior cerebral arteries are more subtle but tend to tuck in the midline, closer to the midline when they course posteriorly. Okay. And let's see if we have a cingulate sulcus. I'd say this is the cingulate sulcus right here, which makes this the central sulcus, which means that everything frontward of this is the frontal lobe, and everything posterior to it is the parietal lobe until you get to the occipital lobe, of course. So this cingulate sulcus is the gateway to understanding the lobes where they begin and end in the brain. So this is the cingulate sulcus. This is the central sulcus, which means you have motor cortex in front of the central sulcus, and that is frontal lobe, and you have sensory cortex posterior to the central sulcus, and that is parietal lobe. So that gives you an idea of where the motor and sensory cortex are, and also gives you an idea of where the frontal and parietal lobes are, so that you can point and say this is a frontal lobe area, this is a parietal lobe area here. So that's the easiest way to distinguish frontal and parietal lobes, is by going to the cingulate sulcus, seeing the central sulcus as forward and lateral to that, and knowing that this central sulcus is right between the motor cortex of the frontal lobe and the sensory cortex of the parietal lobe.